I have decided to venture into my field completely. From today's henceforth, I'll not be doing other content again. I just want to give out what I have to the world. Yes, I'll be talking about drugs, talking about the functions, talking about where it should be taken, and the kind of food you need to eat before you take this kind of medication. So, most people, what they do is they can be taking medication that is not expected of them to be taking. And sometimes if you see symptoms, you just venture into taking something that is supposed not to be taken. Reason being that there are some sicknesses that have the same symptoms with another. Just like I used to tell my friends, something like something like ulcer, that is H. pylori. We can have something like pancreatitis that have the same symptoms with H. pylori. We can have something like gastritis that have the same symptoms with H. pylori. And we can have something like GERD, which is gastric esophageal reflux disease, that have the same symptoms with H. pylori, and so many others. So most people take medication without knowing the actual sickness that is really disturbing them sometimes. And I will always advise you, before you see anything strange in your body, you are advised to go for a test, a checkup, to see a test to be sure of what is disturbing you before you take medication. Most especially infection and some other internal body sicknesses, something like kidney failure or heart problem, liver, and other part of the body sickness. Short, and other part of sickness that can disturb you as a whole. So it is advised you go for a medication, a checkup, a test before you take any medication. And I do tell people clearly that do not undergo self-medication. Make sure you meet with your doctor or your physician who will prescribe the right drugs for you. Sometimes we're in the world where we can take drugs that we don't supposed to take. There are drugs that can interact with each other. There are drugs that can interact with food. There are drugs that can interact with the body. That is why in studies they can tell you have drug-to-drug interaction, drug-to-body interaction, and drug-to-food interaction. So you are not advised to be self-medicated. Please, guys, I love you guys. The next part of my video, I'll be talking about drugs. And I know it will help you guys a lot. It will help a lot. Thank you. I still remain your best guy, Dr. Stein.